Okay, hello. Thank you so much for joining us today for our Got Health Talk, an introduction to diabetes prevention. So my name is Justin. I'm an American College of Sports Medicine certified personal trainer. I'm also a CDC recognized diabetes educator and part of the administrative team for the Center for Community Health and Prevention. And I'm going to have my co-presenter introduce herself as well.
Hi, my name is Mali, and I'm a certified lifestyle coach at the Center for Community Health and Prevention.
Great. And thank you for spending this time with us. We are going to detail a little bit about who is at risk for developing type 2 diabetes and some things that we can do to mitigate that risk.
So there is a growing threat of prediabetes. About 86 million adults have prediabetes, which means more than 1 in 3 American adults have prediabetes. This also means that people with prediabetes don't even know it. So what is prediabetes? It's when your blood sugar levels are higher than normal, but not as high to be considered type 2 diabetes. However, without action, prediabetes can lead to type 2 diabetes. So let's talk about what type 2 diabetes is. So when your body doesn't make or use insulin well, so the sugar builds up in your blood instead of going into your cells, this can mean that your cells is not getting enough energy. Now, type 2 diabetes can harm many different parts of your body, but it can also harm, or it can also increase your risk of heart attack and stroke. It can harm your nerves. It can also have a harmful effect on your renal system, which in extreme cases can lead to kidney failure. Now, it can also affect your eyes, your feet, your gums, and your skin. So who's at risk? So if you are carrying excess weight, typically defined as BMI of 26 or greater. However, BMI has limitations, so please consult with your care team if you have any questions. It can also affect, or you can also be at risk if you're relatively sedentary or spend a lot of time sitting or laying. There's also things that are uncontrollable, like if a parent or a sibling has type 2 diabetes, your ethnicity is also affects your risk. For example, if you're African American, Hispanic, Native American, or Asian American, you have increased risk. Age is also a factor. So if you're 45 or older, you have increased risk. However, type 2 diabetes is also at a rise among young people. Lastly, if you had diabetes while pregnant, also known as gestational diabetes, you are at a higher risk of developing type 2 diabetes in the future. And I'll turn it over to Justin to talk about some good news.
Great, thank you, Molly. And actually, before we talk about the good news, let's also take a look at how we can know if we're at risk. So if you have any specific questions about your own personal risk, please go to the cdc.gov and you can search there, take the test. And that will actually ask you a few questions about your own experience and decide whether or not you're at risk for type 2 diabetes. And so, as Molly mentioned, and thank you, there is good news. And so what is that good news? Well, really, it's that we can manage all of these things with lifestyle. And so lifestyle interventions can actually cut our risk of type 2 diabetes in half. And what are lifestyle factors? So our lifestyle factors are things like increasing physical activity, getting proper nutrition, managing weight, getting adequate sleep, and managing our stress. So focusing on really working towards one or a combination of all of these things can have that great effect on decreasing your risk and actually cut that in half, which is amazing. So of all of those lifestyle factors, there are 2 things that the CDC does recognize as the main pillars for what is most effective in reducing risk. And those are maintaining a healthy weight and ensuring that we are not sedentary for long periods of time and that we are getting enough physical activity. And so when we think about weight, maintaining a healthy weight or a BMI lower than the 26, as Molly mentioned, is helpful for us to prevent or delay type 2 diabetes. Can also ease problems with sleep, such as sleep apnea, arthritis, and depression as well. Maintaining a healthy weight can lower your blood pressure and cholesterol levels and make you feel overall just better. And physical activity does a lot of the same things, but it also prevents or delays type 2 diabetes. It gives you more energy, which is important. It helps us sleep better as well, improves our memory, our balance, our flexibility, has a mood lifting property also that we can look to enjoy, and then also lowers our blood pressure and cholesterol, lowers risk for things like heart attack and stroke, and certainly strengthens your muscles and bones as well. So both managing weight and getting enough physical activity, very important for reducing your risk. And when we say maintaining a healthy weight, what do we mean by that? Well, the CDC recommends that an individual carrying excess weight can significantly reduce their risk for developing type 2 diabetes by losing just 5 to 7% of their total body weight. And so, for instance, this means if you weigh 200 pounds, an appropriate weight loss goal for you would be to lose 10 to 14 pounds. However, you just want to note that only 1 to 2 pounds of weight loss per week is considered healthy. We want to make sure that you are losing weight in a slow and controlled manner. I would certainly consult your care team before starting any weight loss journey, just to make sure that this is appropriate for you. If you're curious to know what the 5 to 7% weight loss looks like for you, you can take your weight and multiply it by 0.05 to give you the 5%, and then also by the 0.07 to give you the 7% as well. So one way that we can get to that managed healthy weight is using our physical activity. Of course, we'll talk more about making proper nutrition choices in a moment. But in regard to being physically active, the Centers for Disease Control and the American Diabetes Association recommend 150 minutes of moderate physical activity weekly. And that physical activity can be structured or unstructured. And so structured physical activity are going to be things like going on the treadmill, maybe lifting some weights, taking a group fitness class, whereas your unstructured activities could look like play with maybe kids or grandkids, could look like recreational sport or hiking or household chores, things of that nature as well. So one mode is not better than the other. Both are great forms of physical activity. And the key word here is moderate. So how do we know if we're working moderately? And so Molly's going to take it away and explain to us how we know just how hard we're working when we're exercising. Molly?
Yeah. So the talk test. The talk test is an easy way to determine your physical activity intensity. And so when your intensity is light, your talk level is going to look like more of a normal breathing. You can hold a song, you can talk, and some of those examples can be slow walking, stretching, light housework. Now, this moderate intensity, which is what Justin was talking about, to achieve that 150 minutes a week, that's going to look more like your breathing is a little faster. You can carry on a conversation, but you cannot hold a song. And that's going to look like brisk walking, some leisurely swimming, or some recreational sports. Now, the highest intensity is going to be that vigorous one, and that level is going to look like you're grasping for your breath. You cannot hold a conversation or sing. Some examples of those are jogging, soccer, dancing. And now Justin's going to talk about some other physical needs.
Yeah. So thank you for walking us through the talk test there, Molly. Love that test. I do think that there are certainly some other physical activity or other needs rather than your physical activity that are important. And healthy food choices is certainly one of them. And then getting adequate sleep is another. And so we know that it's not always ideal and we don't always have the time or the resources to make our plates look as beautiful as the one on the slide here. But we do want to be cognizant of trying to make half of our plate fruits and vegetables when we can, making a quarter of our plate our lean proteins, and another quarter of our plate are whole grains. Also, to make the healthiest food choices, we want to try to make sure whenever possible that we are making water our beverage of choice, and that we're also limiting dairy. And the reasons that we want to limit dairy is that they're a little bit higher in fat content and sugar. So it's not saying that we can't have those foods. It's just something that we want to be a little bit mindful of if we're at risk for type 2 diabetes. And so the other physical need, in addition to healthy food choices and regular physical activity, is sleep. So we want to make sure that if we are 18 years or older, that we are getting at least 7 hours of sleep per night. And also remember that doing some physical activity will help you get both longer hours of sleep and more quality sleep. And so we'll talk more about in detail the macronutrients and how we can use them to our advantage to reduce risk of developing type 2 diabetes. And the biggest thing that we can do is limit foods that are high in fat, because fat carries the most calories per gram. But if we're thinking about our proteins, right, or a quarter of our plate, they are 4 calories per gram. Our carbohydrates are also 4 calories per gram. Our alcohol is a lot higher at 7 calories per gram. And then our fats are the highest of the macronutrients at 9 calories per gram. Unfortunately, both the good fats and the bad fats are 9 calories per gram. So those good fats being the things like the avocado and the salmon, as you see in this picture, that have healthy fats, good for your brain, good for your heart. But they're also 9 calories per gram. Similarly, the dish of butter or margarine, things solid at room temperature, or those saturated fats, are also 9 calories per gram. So while we want to limit our dairy because it's high in sugar and fat, we also want to limit foods if we have a weight maintenance goal or want to reduce our risk that are inherently lower in fat. And that's one way to reduce the amount of calories that we're taking in. So how do we know if we're doing a good job with this? Well, we have to have some type of feedback or some way that we can understand how we're doing. And so you are much more likely to achieve a goal that is written. So we highly recommend some form of tracking. Tracking increases accountability and chances for success. And there are many ways that we can track not only the food that we're taking in, but also the exercise or the calories that we're burning. And so some of those are apps like the MyFitnessPal app, the Spark People app, the Drink Water Reminder app, Fujicate.com, and of course, there's a lot of great healthy information and resources on the myplate.gov website that I highly recommend looking at. And so Molly is going to tell us a little bit more about how to find a program that may be helpful for us to reduce our risk.
Yeah, so the DPP is an evidence-based CDC recognized program that is designed to help prevent or the development of type 2 diabetes. It is structured as a year-long program with a lifestyle changing program that covers information about nutrition and physical activity and so much more. And if you are interested to find a program near you, you can go to the CDC website and search diabetes prevention, find a program.
Well, thank you all so much for taking the time to join us today for this Got Health Talk, Introduction to Diabetes. We hope you enjoyed.